Hello everyone, my name is Maggie Gill and I'm the CEO of the Palm Beach Health Network, and I'm here with Julie Abbate, a nurse practitioner at Delray Medical Center. This is episode 3 of Getting Candid on COVID, and we are still taking your questions that we're hearing from our staff and in the community to keep everyone informed on the latest situation.
Great. So Maggie, one of the big questions is certainly about testing. The length of time that testing is taking, who's getting tested. Tell us about that.
Yes, that's a great question because it's a big concern out there and there's a lot of information and misinformation about testing. So first, let's talk about testing availability. Currently, testing is being prioritized for people who are high risk, including people who are over the age of 65 and have a condition, a pulmonary or cardiac condition, healthcare providers, as well as first responders. When those tests are being taken, when people are being swabbed and the tests are sent out to commercial labs, the turnaround time is longer than perhaps people understand. So turnaround times could be anywhere from a few days to upwards of over a week, depending on the lab. The lab sends the test, could be locally or it could be to a test in another state, at which point those testing results are reported to the Department of Health in the state where the test is run, and then it comes back to the state of Florida. So it's not quick right now, and we're working very hard with state officials and with other labs in the community to be able to improve the testing turnaround time and also the availability. Another issue that is seen around the country is the availability of lab supplies to be able to perform the test. And so more and more labs are coming up with ways that they can produce their own tests and going through expedited approval processes with the FDA and other lab certification companies. So we're working on it very hard. We know that the turnaround time and accessibility should be more. I think that this is a problem around the country, and so with the support of the local health department, with our company, with the federal government, we're all doing all that we can to improve the accessibility and capabilities of testing. Julie, I'd like to ask you a question.
Sure.
Okay, so I hear a lot about soap or hand sanitizer, and there's a run on hand sanitizer like there's a run on toilet paper right now. So can you please explain for us which one is better? And I've heard that soap actually, and washing with soap can break down the outside of the virus. So can you explain that to us, please?
Sure, I can do that for you. So a lot of questions come out about using soap and water versus hand sanitizer. And what we know to be true per CDC guidelines, when we look at that, is that soap and water really breaks down not only the virus in terms of COVID-19, but it also helps with all other bacteria. So that's really the best thing to be using when we're washing our hands. Certainly hand sanitizer is quick and it's easy, so if you're coming out of an area and you don't have access to soap and water, certainly that's acceptable. But if we have access to soap and water, that should be the primary thing that we're using.
Oh, that's great. So hand washing and sing happy birthday 2 times.
Yes,
right?
2 times for 20 seconds.
20 seconds
yes.
of hand washing.
Yes, absolutely.
You know, another question that I've been getting a lot is, what do I do if I'm concerned? I think I might have a symptom. You know, we talked about the fact that testing is not widely available if you're the worried well or if you have mild or moderate symptoms. So we have Dr. Milan with us. He's a pulmonologist and critical care doctor at Delray Medical Center, and I'd like for him to answer that question. Dr. Milan, thank you for joining us. So, question we're hearing is, what do I do if I'm concerned? I may not have symptoms, or I may have mild or moderate symptoms. What do I do?
That's a really good question. You know, being in pulmonary and critical care, we see the full spectrum of this disease process. And we certainly get a lot of phone calls in our office with that exact question. We would say, and we keep harping on, and I think it's absolutely paramount, that if you have mild symptoms, and really no other major comorbidities that would put you at higher risk, I would just stay at home. That is the most important thing you can do for yourself, for your loved ones, for your community around you, and they also help people like us who have to take care of you. So, you know, I think that that's probably the biggest take home I've told my patients is, if you're not feeling well, stay home. Continue washing your hands, soap and water. By now we've all gone through how to wash our hands, right? We're all going through kindergarten all over again. But I think that's probably the most important message I would say to people with that question.
So social distancing, wash your hands, And you know, the treatment is the same, right? Stay home
The
and
treatment is actually the same. You know, the hospital, you know, we really reserve it for people who need, you know, hospitalized and higher intense care. But otherwise, for mild symptoms, you know, you're doing the same thing that we would do, is just keep you isolated and just support your symptoms with over-the-counter remedies.
thank you, Dr. Milan, very helpful. You're on the front line, really. You're taking care of patients, you're working with nurses, with respiratory therapists, and you know, we want to express our deep appreciation for what you're doing. And so maybe you could also share some kind words for the caregivers out there, just expressing your appreciation for this. It's a difficult time, right? There's a lot of unknowns, there's a lot of anxiety, uncertainties, and you know, our first video we said we're all in this together, and so.
Yeah, we really are. I think, you know, in our hospital, there's a really deep sense of, you know, connection with the community. And, you know, those aren't just patients walking in, you know, these are our neighbors. And, you know, I've never seen our team of nurses, respiratory therapists who are huge unsung heroes, ourselves in the doctor realm. I've never seen so many people just really committed to the same goal, is taking care of our patients and taking care of each other. And that's really made us stronger, I think, as a team. And, you know, it's, I guess, a little glimmer of a good thing coming out of a really horrible situation. But yeah, we're all in it together, and we're gonna get through it. But we feel privileged to be working with each other.
That is well said. And I want to thank the entire group and everyone who is working across our 5 hospitals, our first responders, our medical staff, for everything that you're doing every day. Thank you.